This is Dr. Renee here at Shift Physical Therapy. I'm the physical therapist here. I'm joined with Dr. Taylor, the chiropractor from Willowbridge. And we are here today. Maybe you followed us from our Facebook site, or maybe you're just joining us here at the Educational Library, but welcome. We're here kicking off our series of videos regarding the benefits of chiropractic care and physical therapy care during pregnancy and after.
Yeah. So we're just going to start off by talking a little bit about chiropractic and what you can expect or why you would want to see a chiropractor starting when you're pregnant. What some things we look for when we are starting care is just that your body is going to be going through a lot of different changes. And right now for the first trimester as a chiropractor, we're not really going to be changing or adjusting too much quite yet, just because the fetus is still pretty small, that we aren't too concerned about having to use a pregnancy pillow. And we're able to adjust usually how you would be normally being adjusted pre-pregnancy. So what my job is just to focus on making sure that your body is functioning properly, checking your spine for any sort of subluxation. And what a subluxation is when that bone misaligns and is causing pressure on the spinal cord and putting pressure on that nervous system. So we just want to make sure that we are finding that subluxation, correcting it, and letting your body function properly in the way that it should be, especially during pregnancy when you are in such an exciting time and growing another human, which is pretty incredible.
Yeah, so for physical therapy, things are also kind of similar to as it has been previously. And even if you're just planning to get pregnant or you're already in that first trimester, we're really at that point that you're not going to necessarily start a brand new exercise routine, but there certainly are some things that we can start to do to prepare us as we move through the pregnancy. So that first trimester can be a little bit difficult because you may not know what to expect in the weeks to come. But being able to take control and start learning about your body at this point is really important and helpful. So stick around and we're going to show a couple demonstrations of some exercises and things that you can be doing right now in your first trimester to help prepare you for your body's changes along the way through pregnancy. So stick around. During pregnancy, you can expect the growing belly to start gently pulling the pelvis forward into what we call an anterior tilt, where the lower back is in a more exaggerated arched position compared to pre-pregnancy. This position can cause some discomfort through the lower back as the growing baby continues to expand and pull forward on the lower back and pelvis. These next exercises are helpful in identifying the position of the pelvis and being able to move the pelvis into a more posterior or flattened position to alleviate some of the discomfort in the lower back. While Jackie starts by showing the exercise in a laying down position, you can move into a seated position or even into a standing position to use this throughout your day.
This first exercise is called a pelvic tilt. You're going to lie on a bed or a table with your knees bent. Try to pull your belly button in towards your spine and flatten your back onto the table. You can use your hands and put them at the front of the hips to help with feeling that tilt. Remember to breathe during the exercise. The second exercise is a progression of the tilt. Once you have it down laying on a bed, you can move to a seated position either on a chair or a ball.